Hi there to all our Korean followers. Today I would like to talk about what it means to be a cancer patient in Korea. And this is actually from a perspective from someone actually from the outside. I've worked in Korea on different occasions at different hospitals in Seoul, and I saw how cancer patients are treated in the outpatient clinics as an inpatient. So I would like to share with you my thoughts about that, and also how Cancer De Novo can actually improve patient care, and specifically cancer patients in Korea. So there is no doubt that cancer treatment in Korea is really maybe one of the best in the world. Treatments and patient care are really with very high standards. Oncologists there are also very well trained. But we want to focus today on actually the personalized touch and the personalized approach to those patients. So when a cancer patient in Korea is diagnosed, uh, obviously they would want to have treatment at one of the best centers. And what happens is that actually many patients from all around Korea come to Seoul to different centers, big centers, to get their treatment. So actually there's like a centralized a way of treatment, which makes it actually very tough on oncologists in those major centers, because those centers are usually very crowded. So this is one factor that makes it hard to give a personal approach and sufficient time for those patients. So when I've been to one of the outpatient clinics in Korea, I was amazed the time that is actually given for a new patient that doesn't know his doctor, has to get all the explanations about the treatment side effects, a follow-up, etc., is usually between 15 and 20 minutes. Imagine 15 and 20 minutes. So when I sat there, I was really surprised. The patient doesn't even ask questions, maybe one or two questions at most. It's just the doctor talking, explaining everything, and then the patient is being forwarded to a nurse for further instructions. So there is actually no personal approach to the patient. And when we're talking about a new patient that has to actually have this enormous change in his life, he needs to undergo treatments. Sometimes those treatments are for months, etc. And the first meeting with his oncologist is about 15 to 20 minutes. So you can imagine that that's quite problematic. Also, the follow-ups for those patients, when they come again to see their oncologist, they're also sometimes between 5 to 10 minutes, because those clinics are very crowded, and the oncologist sometimes has to see between 30 to 40 patients a day in his clinic. So obviously there is no time to go through everything with the patient and answer the patient's questions. Some doctors would tell me in Korea, okay, there are specialized nurses that work in those clinics, and they could answer patients' questions if those occur after the patient leaves the doctor's clinic or when he's at home. But I mean, we have to understand here, the patient wants to talk to his doctor. He doesn't want to talk to the nurse. In many cases, well, in some cases, maybe the nurse would give them the answers and would reassure them. But in most cases, the nurse would just say, okay, I'll forward your question to the doctor, and maybe after 2-3 days they get an answer. Sometimes they even don't, and have to wait for their next visit to the doctor, which sometimes can be between 3 to 6 weeks, in order to ask their questions. And when we're talking here about people who are fighting for their life, obviously this is something that needs to be changed, and we have to work on it. And here, Cancer De Novo comes in play. It is important to understand Cancer De Novo is not there to replace your oncologist. Um, we don't take the treatment decisions for your oncologist or for you. We are there to give you the missing support that you need without actually leaving your home. So you can ask us questions, you can ask for a second opinion, you can ask for a video chat with an oncologist without leaving your comfort zone. We are there to fill this missing gap, which is very crucial for cancer patients. Cancer patients want to be sure that they have done the maximum in order to get the best treatment option. Those people are fighting for their lives, their loved ones worry about them, and even if we do not give any new information for the patient, and just by answering their questions, giving them the time, this reassurance, reducing the anxiety for patients, can sometimes improve treatment outcomes. So go to Cancer De Novo, read about us, read our story, why this service started, what services we offer. If you have any questions, please do not hesitate to send us your questions. We have also a Korean speaking staff. Our patient coordinator, Ms. Mia Ra, would be happy to answer your questions in Korean and forward them to me. I would like to wish all Korean patients and all our followers, from me personally, good health, and hopefully that you'll be cured from your cancer. And if we can help you in any way, please do not hesitate to reach out. Have a wonderful day. Thank you.